Hey there folks, ever wondered what happens when the tiny veins in your lungs decide to take a break? Or what if a disease is so rare that even doctors can barely identify it until it's too late? Let's dive into Pulmonary Veno-Occlusive Disease, or PVOD, a disorder that's as mysterious as it is deadly. Alright, what exactly is PVOD? PVOD is a super rare and serious lung disorder where the small veins in your lungs get thick and narrow. These veins are supposed to carry oxygen-rich blood from your lungs back to your heart. When these veins get clogged, it's like a traffic jam in your lungs. This causes a rise in blood pressure in the pulmonary arteries, leading to pulmonary hypertension. In simpler terms, your heart has to work way harder to pump blood, which can eventually lead to heart failure. Diagnosing PVOD is like solving a complex puzzle because it shares symptoms with other lung diseases. Doctors often need a mix of tests to pin it down. This can include imaging tests like chest x-rays or CT scans, lung function tests, and even a procedure called right heart catheterization. The gold standard for diagnosis is a lung biopsy, but it's risky and rarely done. So, what are the signs and symptoms of PVOD? Early on, you might just feel a bit out of breath, especially when you're active. As it progresses, you could experience fatigue, swelling in your legs and ankles, a bluish tint to your lips and skin, and a rapid heart rate. It's easy to brush these off as minor issues, but they could be signs of something much more serious. PVOD is incredibly rare, affecting only a handful of people per million because it's so uncommon. And its early symptoms are subtle, it often gets misdiagnosed or diagnosed late. This delay can be crucial, as early detection and treatment are key to improving long-term outcomes. Interestingly, both inherited and acquired forms of PVOD exist, with some cases linked to genetic mutations and others to environmental factors like certain chemicals and medications. Now, let's talk numbers. PVOD doesn't discriminate much between males and females, but it's still a bit of a mystery in terms of who is more likely to get it. Unfortunately, the survival rate isn't great because it's a progressive disease. But with early diagnosis, proper management, and maybe even a lung transplant, there is hope. So, what's the takeaway here? PVOD may be rare, but is deadly serious. If you ever feel out of breath or notice any of the symptoms we talked about, don't ignore them. Early detection could make all the difference. Thanks for tuning in and stay healthy out there.